Care Advantage Infectious Disease Prevention, SARS-CoV-2 virus that causes COVID-19. Emergency Temporary Standard, training creator and narrator Chelsea Ammons, Vice President of Nursing. From day one, our expert teams across our footprint have met and overcome a variety of challenges in a highly professional and responsive manner. This is a trait we hope you would expect and have become accustomed to in working with Care Advantage. We continue to proactively review and bolster our already robust protocols. We've especially focused on clinical and operational aspects, client safety, and service. We greatly appreciate your time and attention during this training. Care Advantage has assigned the following individuals to serve in the role of Health Officer. The Health Officer has the authority to stop or alter activities to ensure that all work practices conform to the mandatory safety and health requirements applicable to COVID-19, as well as any other infectious disease hazards. Coronavirus explained. SARS-CoV-2 means a beta coronavirus, like MERS-CoV and SARS-CoV. Coronaviruses are named for their crown-like spikes on their surface. The SARS-CoV-2 causes what has been designated as the coronavirus disease 2019, or COVID-19. Signs of COVID-19 include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, etc. Suspected to be infected with SARS-CoV-2 virus means a person that has signs and symptoms of COVID-19 but has not tested positive for SARS-CoV-2, and no alternative diagnosis has been made. Symptomatic means the individual is experiencing symptoms similar to those attributed to COVID-19, including fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headaches, sore throat, new loss of taste or smell, congestion or runny nose, nausea or vomiting, or diarrhea. These symptoms may appear in 2 to 14 days after exposure to the virus. This slide explains the purpose of the Emergency Temporary Standard, or ETS. This was designed to establish requirements for employers to control, prevent, and mitigate the spread of SARS-CoV-2, the virus that causes the coronavirus 2019, or COVID-19. This applies to every employer, employee, and place of employment in the Commonwealth of Virginia. This is also based on the exposure risk level of its employees, and you will see that further explained as we go along these slides. Determining exposure risk level. Based on OSHA publication 3990, we have determined the COVID-19 exposure risk level of all worksite functions to ensure that we apply appropriate hazard controls, such as training, equipment, and PPE. These things are used to protect employees' safety and health. Risk exposure determinations are made without regard to employees' protected characteristics as defined by local, state, and federal law. In this table, you will see the exposure risk levels. They range from very high to lower. Further slides will explain where you will fall. Here you will see the Care Advantage risk classifications. Very high are those healthcare workers performing aerosol-generating procedures, or those collecting and handling specimens from potentially infectious patients or employees, known to have or suspected to have COVID-19. High are those caregivers and clinical staff providing direct COVID-positive care or support within 6 feet to known or suspected COVID-19 patients. Medium are caregivers and clinical staff providing direct patient care within 6 feet to patients who are not known or suspected to have COVID-19. This is where most of our field staff will fall. Low are those corporate and office staff members, sales team, and supervising clinical staff. Care Advantage Inc. is devoted to ensuring the safety and well-being of our staff and those that we serve. To monitor for potential risks for the spread of infection, the health screening questionnaire or its components will be required until further notice. I'm sure each of you have seen the reminders, whether it be through text, through email, or a calendar invite. You will receive that health screening questionnaire every day. Please ensure that this is done on a daily basis. Keep in mind that any health-related information and documentation gathered from employees is maintained confidentially and is in compliance with state and federal law. Specifically, medical documentation is stored separate from employees' personnel documentation. If an employee is unwell or experiencing any health-related change that is different from their baseline, they must notify their supervisor prior to returning to work. The follow-up actions will be determined after discussion with the clinical supervisor. As stated prior, all active caregivers and office team employees are required to complete that health screening questionnaire via the online link daily and are mandated to self-report any changes of their responses to their home office or supervisor immediately. This link will change monthly, so please keep that in mind. All clients and client households are screened prior to the initiation of services by both the intake department and clinical team and during each clinical or office touchpoint, with the reminder to self-report any changes of their responses. At the completion of every shift, the caregiver is asked to report any changes or concerns that they may have about their assigned client. These responses are reviewed by the office clinician. As discussed, before each shift or beginning the day, you're required to answer the following questions. 1. Have you experienced any of the following symptoms in the past 72 hours? Fever at or greater than 100.4, cough, shortness of breath, muscle aches, sore throat, new loss of smell or taste, and/or GI problems, including nausea, vomiting, and diarrhea. 2. Have you been in close contact, personally or professionally, and close contact is defined within 6 feet of that individual, with a confirmed case of COVID-19 or someone displaying the above symptoms in the last 14 days? If you answer yes to any of these questions, you are to notify your supervisor immediately before reporting to work. Employees who develop any of these symptoms during their shift must also immediately report this information to their supervisor. Also, those that are providing direct care to patients, if you note a change in your patient, please notify your branch office immediately. The following employees should not report to work, and upon notification to Care Advantage Inc. will be removed from the regular work schedule. 1. Employees who display COVID-19 symptoms such as fever, cough, shortness of breath, sore throat, new loss of smell or taste, and/or gastrointestinal problems, including nausea, diarrhea, and vomiting, whether or not accompanied by a formal COVID-19 diagnosis. 2. Employees who in the last 14 days have had close contact with and/or live with any person having a confirmed COVID-19 diagnosis. And 3. Employees who in the last 14 days have had close contact with and/or live with any person displaying COVID-19 symptoms such as fever, cough, shortness of breath, sore throat, new loss of smell or taste, and/or GI problems, including nausea, diarrhea, and vomiting. Such employees may only resume in-person work upon meeting all return to work requirements defined within this training and in the infectious disease COVID-19 preparedness and response plan. Care Advantage Inc. will ensure employee access to their own SARS-CoV-2 and COVID-19 related exposure and medical records in accordance with the standard applicable to its industry. Employees who were themselves diagnosed with COVID-19 may only return to work upon confirmation of the cessation of symptoms and contagiousness, proof of which may be acquired via the test-based strategy or the non-test-based strategy explained in the following slides. For employees out of work due to COVID-19, the following Human Resources hotline may be used. Please see the information on your screen. Care Advantage Inc. will follow state and federal guidance for return to work guidelines. This slide speaks to return to work, the symptom and test-based strategies. The symptom-based strategy excludes an employee from returning to work until at least 3 days or 72 hours have passed since recovery, which is defined as the resolution of fever without the use of fever-reducing medications, as well as improvement in respiratory symptoms such as cough and shortness of breath, and at least 10 days have passed since those symptoms first appeared. The test-based strategy excludes an employee from returning to work until the fever has resolved without the use of fever-reducing meds, and improvement in respiratory symptoms such as cough or shortness of breath, as well as negative results from at least 2 consecutive respiratory specimens collected greater than or equal to 24 hours apart. That is 2 negative specimens for COVID-19. This speaks to return to work for the asymptomatic or the individual with no symptoms with the time-based strategy. The time-based strategy excludes an employee from returning to work until at least 10 days have passed since the date of their first positive COVID-19 diagnostic test. This is assuming they have not developed any symptoms since that positive test occurred. If they develop symptoms, then the symptom-based or test-based strategy shall be used. Upon notification of a positive test, all local branches who obtain this information are required to report it to clinical leadership and/or a health officer. Clinical leadership and/or the health officer who receives reports of positive tests will follow HIPAA guidelines and state and federal confidentiality laws and work with branch leadership to notify involved employees, co-workers, employers of other employees present, the building or facility owner, and the Virginia Department of Health within 24 hours of that result notification. The Virginia Department of Labor and Industry will be notified within 24 hours of the discovery of 3 or more positive results from the same location within a 14-day period. To control the spread of infectious disease, it is important to keep up general housekeeping in the workplace or client home. Additional housekeeping actions must also be implemented to ensure the safety and health of all and decreasing the chances of spread of infection. All restrooms, common areas that remain in use, doorknobs, handles, equipment, and other frequently touched surfaces must be disinfected before, in the middle of, and at the end of each shift. All contact surfaces of vehicles used by more than one person are disinfected at the end of each person's use. All disinfectants are EPA approved or otherwise comply with CDC disinfection guidance. Care Advantage Inc. is focused on ensuring the safety and well-being of all employees and clients. Along with the disinfectant requirements mentioned in the prior slide, the office or branch settings should ensure that there is no sharing of workstations, areas, or equipment. Physical or social distancing of at least 6 feet from other employees present is required. Frequent hand washing with soap and water, including any time you leave your workstation, is also mandated. Utilizing of hand sanitizer if soap and water are not available should be done. Respiratory and cough hygiene is also very important during this time. Please ensure that updated signage is placed on the door advising of mask and temperature requirements. Areas where individuals known or suspected to be infected with SARS-CoV-2 virus have accessed or work shall be cleaned and disinfected prior to allowing other employees to access the area. Where feasible, a period of 24 hours will be observed prior to cleaning and disinfecting. This requirement shall not apply if the areas in question have been unoccupied for 7 or more days. Physical distancing, also called social distancing, means keeping space between yourself and other persons inside and outside of the physical establishment by staying at least 6 feet from other persons. Blue tape has been utilized in the branches to notate the required distance at workstations. Physical separation of employee from other employees or persons by a permanent solid floor to ceiling wall constitutes physical distancing from an employee or other person stationed on the other side of the wall. In the office locations, at the entrance of the designated common areas or rooms, the following is posted: the policy limiting the occupancy of the space, the requirements for physical distancing, hand washing, hand sanitizing, cleaning and disinfecting of shared surfaces. And Care Advantage Inc. shall limit and enforce occupancy restrictions of the designated common area or room so that occupants maintain physical distancing from each other. Office or branch entry temperature requirements. All office staff or visitors must immediately report to the temperature station prior to going to their personal workspace or any other area of the office. This should be done one by one upon arrival, ensuring that social distancing is maintained during the entire process. All employees or visitors will be required to don a face mask or face covering prior to entry. After performing hand hygiene with the hand sanitizer, the employee or visitor takes his or her own temperature. All visitors will be proctored. If the reading is at or above 100.4, the employee or visitor will not be permitted to enter. All visitors will be required to reschedule their visit after they have been fever-free for at least 72 hours without fever-reducing medications. All employees will be required to notify their supervisor and will not be permitted to return until they are fever-free for at least 72 hours, again without fever-reducing medication. The VPN and HR should also be notified of any of those that do not pass the temperature screening and which are office employees. If any individual fails the screening, please ensure that the disinfection of any surfaces touched is complete. What is PPE? PPE stands for Personal Protective Equipment. This refers to the equipment designed to protect the wearer from injury or the spread of infection or illness. When used properly and with other infection control practices such as hand washing, hand sanitizing, covering coughs and sneezes, it minimizes the spread of infection from one person to another. The most effective way to prevent the spread of infection is hand washing. Please ensure that you scrub your hands for at least 20 seconds. Rinse and then dry with a clean paper towel. Isolation precautions explained. Standard precautions are the type of precaution used for all patients in all situations and involves the use of hand washing and gloves when there is the anticipation for possible contact with blood, stool, or bodily fluids. Contact precautions are used for infections, diseases, or germs that spread by touching the patient or item in the room. Healthcare workers should wear a gown and gloves while in the patient's rooms for contact. Droplet precautions are used for diseases or germs that are spread in tiny droplets caused by coughing and sneezing. Healthcare workers should wear a surgical mask, gown, and gloves during droplet precautions. Airborne precautions are used to protect against airborne transmission of infectious agents. Healthcare workers should wear gloves, gown or clothing cover, respirator, mask, goggles or face shield, and shoe covers. The CDC recommends wearing a cloth face covering or mask in public settings where other social distancing measures are difficult to maintain, especially in areas of significant community-based transmission. If wearing a cloth or handmade face mask, ensure that it is washed regularly. If you do not have a mask, please notify your office and we will assist you. Mask requirements. Office staff. Wearing of masks when away from personal workstations will be required. For example, when passing through common areas, greeting visitors, or otherwise working within 6 feet of another. Employees do not need to wear masks, but are welcome to do so if they choose while working in a confined, segregated space. For example, a closed office or cubicle not within 6 feet of another's workspace. Field team staff. All individuals providing direct patient care to individuals who are not known or suspected to be infected with the virus are required to wear a mask when within 6 feet of the patient or any other parties within the home or facility. If providing COVID-positive transmission-based precaution care, the transmission-based precaution policy must be followed and proper PPE utilized at all times. Clinical staff. Clinical staff overseeing provided care are required to wear a mask for the entire duration of the visit. When should you wear gloves? When cleaning and disinfecting the area around the person who is sick or other surfaces that may be frequently touched in the home, or when having contact with blood, stool, or bodily fluids such as saliva, mucus, vomit, and urine. When should you change your gloves? You only need to change your gloves when leaving the patient area or they become torn or heavily soiled throughout your shift. Also be sure not to touch your face or clothing when wearing gloves and avoid touching surfaces except when necessary to provide care. When should you not wear gloves? Gloves should only be used when cleaning possibly contaminated surfaces or when there is a potential for exposure to blood, stool, or bodily fluids when providing care. You should not wear gloves in public, for example when using a shopping cart or an ATM, as this will not necessarily protect you and may lead to the spread of germs. The best way possible to protect yourself from germs when running errands and after going out is to regularly wash your hands with soap and water for 20 seconds or use hand sanitizer with at least 60% alcohol. A gown should only be worn if the patient being cared for is on contact, droplet, and/or airborne precautions, or it has been advised by the office nurse or healthcare facility to be worn. Although our company has done an excellent job ensuring that we have the necessary equipment during this time, it is important to optimize our supply and only use the items when it is determined necessary. As you are likely aware, there is a worldwide shortage of PPE, and it is our duty to be responsible and mindful of how and when we use these items. The PPE utilized is determined by the type of anticipated exposure, such as touch, splashes or sprays, or large volumes of blood or bodily fluids that might penetrate the clothing. PPE selection is determined by the category of isolation precautions that a patient is on. The office nurse or facility in which you are working, in collaboration with the patient's healthcare team or physician, will determine the category of isolation precautions necessary, as well as the need for PPE. COVID-19 precautions. The World Health Organization recommends that standard, contact, and droplet precautions, so gown, gloves, and medical masks with eye or face protection, is used for all personnel entering the room of a patient with suspected or confirmed COVID-19. The addition of airborne precautions, a respirator, is warranted during aerosol-generated procedures such as bronchoscopy, tracheotomy, suctioning, etc. Here you will see the sequence for putting on personal protective equipment and removing. Please see your office to obtain handouts on these procedures. For COVID-positive care, all assigned caregivers or clinicians must have completed the transmission-based precautions training and have been checked off by a COVID response team or COVID task force clinical team member. The following supplies will be given: gown, N95 or KN95 mask, 2 head coverings, 20 pairs of gloves, booties or shoe covers, a paper bag to store reusable goggles, 2 trash bags, paper towels, hand sanitizer, antiviral wipes, goggles, and the transmission-based precautions policy, which should be adhered to at all times. Discrimination against an employee for exercising rights under this standard is prohibited. No person shall discharge or in any way discriminate against an employee who voluntarily provides and wears his or her own personal protective equipment, included but not limited to a respirator, face shield, or gloves or face covering if such equipment is not provided by the employer, provided that the PPE does not create a greater hazard to the employee or others. No person shall discharge or in any way discriminate against an employee who raises a reasonable concern about infection control related to SARS-CoV-2 virus and COVID-19 disease to the employer, the employer's agent, other employees, a government agency, or to the public, such as through print, online, social, or any other media. Nothing in the standard shall limit an employee from refusing to work or enter a location they feel is unsafe. Thank you very much for your time and attention during this training. This will help ensure your safety as well as the safety of others. Please also ensure that you access and complete the SurveyMonkey link for certification of the training. Thank you.